Muscle strength, the maximal amount of force that a muscle or muscle group can voluntarily exert in maximal effort. When type of muscle contraction, limb velocity and joint angle are specified can be defined as muscle strength. Shoulder flexion, against gravity position, start position, sitting in a chair with the arm down at the side in mid position. Instruction: lift your arm in front of you to shoulder height. Do not let me push it down. Resistance: the therapist hand places over the distal end of the humerus, pushes down toward extension. Gravity eliminated position, start position, lying on the side with the arm along the side of the body. In mid position, therapist support the arm under the elbow. Instruction: try to move your arm so your hand is at the level of your shoulder. Palpation: palpate the anterior deltoid immediately anterior to the glenohumeral joint. The coracobrachialis may be palpated immediately to the tendon of the long head of the biceps, which is palpated on the anterior aspect of the humerus. Now we see the measurement procedure.
So in this video, I will tell you how to do manual muscle testing of shoulder flexion and extension movement. So first, I will tell you how to do manual muscle testing of shoulder flexion. We all know that MMT has grades from 0 to 5. When we have to do MMT test, we have to start from grade 3. To do MMT of shoulder flexion in against gravity, the patient should be in seated position in a chair with arm down at the side. The patient should be asked to perform shoulder flexion movement and take the shoulder as much as he can. You perform the movement. Here the patient has been able to move at full range, so muscle grade is 3. Grade 3 test has been done. Now I will test grade 4 and 5. For this, one hand should be stabilized above the clavicle and scapula, and with the other hand, resistance should be placed on the distal end of the humerus when shoulder flexion is at 90. Patient has been able to hold and move shoulder through full range and able to take moderate resistance. So here muscle grade is 4. Now I will test grade 5. Resistance on the distal end of the humerus. Patient has been able to hold and move shoulder through full range and take maximum resistance. So here muscle grade is 5. To do MMT of shoulder flexion in gravity eliminated, the patient should be lying on the side with the arm along the side of the body. Move arm so her hand is at the shoulder level. Patient has been able to move shoulder through full range in gravity eliminated position with no resistance. So muscle grade is 2. Now I will test for grade 2 plus. For this, one hand should be stabilized above the shoulder and resistance should be placed on the distal end of humerus by other hand. Patient has been able to hold and move and takes minimal resistance, so muscle grade is 2 plus. If movement is not possible, then I have to palpate the anterior deltoid. When tension is palpable in the anterior deltoid, the muscle grade is 1. When no tension is palpable, then muscle grade is 0.
Shoulder extension, against gravity position, start position, sitting with the arm by the side and the humerus internally rotated. Instruction: move your arm straight back as far as it will go. Keep your palm facing the back wall. Resistance. The therapist's hand placed over the distal end of the humerus pushes forward toward flexion. Gravity eliminated position. Start position. Lying on the side with the arm along the side of the body and in internal rotation. Therapist support the elbow during the motion. Instruction. Try to move your arm backward. Palpation. The latissimus dorsi and teres major form the posterior border of the axilla. The latissimus dorsi is inferior to the teres major. Now we see the measurement procedure.
Now I will tell you how to do manual muscle testing of shoulder extension. To do MMT of shoulder extension in against gravity, the patient should be seated with the arm by the side. Move arm straight back as far as it will go. Here the patient has been able to move at full range, so muscle grade is 3. Now I will test grade 4. Resistance should be placed on the distal end of the humerus. Patient has been able to hold and take moderate resistance, so here muscle grade is 4. Now I will test grade 5. Again, resistance should be placed on the distal end of the humerus. Patient has been able to hold and take maximum resistance, so here muscle grade is 5. Now I will do MMT in gravity eliminated position for grade 2. To do MMT of shoulder extension in gravity eliminated, patient should be lying on the side with the arm along the side of the body. Move arm backward. Patient has been able to move at full range, so muscle grade is 2. If movement is not possible, then I have to palpate the posterior deltoid. When tension is palpable in the posterior deltoid, then muscle grade is 1, and when no tension is palpable, then muscle grade is 0. So this was the procedure of manual muscle testing for shoulder flexion and extension.